Hi everybody, welcome back. It's Dina and Yaku here at Shine Dental Clinic, and we are here today to talk about adult orthodontic treatment. So this is something that's been really big of late. It's been around for quite a long time. We've all heard of various brands that you can see, and obviously now you also get it advertised quite a lot on TV.
Yes.
One of the ones that we use at the clinic is something called 6 Month Smile. So Yaku is going to talk to us about this.
Right, yeah. So 6 Month Smiles is what they call short-term orthodontics, and it's mainly aimed at at adults, so over the age of 18, and it's mainly meant for patients that have maybe one or two teeth that's so slightly crooked, or there's a slight amount of overcrowding, or just something that just bugs you a little bit about your smile. And as the name suggests, it's a treatment that normally takes about 6 months. It can take a little bit longer, but my patients absolutely love it. And it comes in a couple of different guises or ways that we do it. So first of all, the first way we do it, and my favorite, is to use fixed aligners. So this goes back to the more sort of traditional orthodontics, where there's a bracket that's attached to your tooth, and that bracket stays on your tooth for 6 months' time, and then we've got an arch wire that we use to correct the angle of that tooth. So if I can just show you, you can see there, the brackets are made from a clear acrylic material, and the arch wire is a clear metal or a tooth-colored metal wire as well, and then you've got a little bracket on your molar over there. So this goes onto the upper and lower arch, and then you can see that's what the lower arch looks like. So if I just hold it like that, you can see what it looks like. So it's not very noticeable. I mean, it obviously stands out, and but it is not that noticeable. But patients seem to get used to it very, very quickly. They adapt to it very quickly, and they just love how quickly that moves their teeth. So,
is there anybody who you wouldn't suggest this type of treatment for?
Well, I think it's I think if you are under the age of 18, then it might be more suitable to look at a more comprehensive orthodontic treatment plan, because this really isn't designed to adjust your bite. It's just there to correct small little problems in your appearance, it's not really suited for patients that's got gum disease or a lot of overcrowding. If there's a lot of overcrowding and a big amount of space shortage, then this technique or this product isn't really meant for you.
So I think what we're basically saying is that anybody who wants to consider any of this type of treatment ultimately is cosmetic treatment. Yeah. So you have to obviously make sure your dental health is good.
Yes.
I mean, and that's the case that we've talked about before in our videos of other kind of treatments like veneers and bridges and implants, and actually having a good stable mouth is really important with any of this treatment. Yeah,
so that's it. And there is another treatment out there, or another way of treating small little teeth that are not in an ideal position, and that's with removable aligners. Some people, you might know it from brands like Invisalign. So the removable aligners are a lot less invasive. You don't bond anything or stick anything to the tooth structure, but it's often not takes longer than 6 Month Smiles or a fixed aligner, and you still have to wear that removable aligner for majority of the day and sleep with it to get a good result. So it might seem like it's an easier way to do it, but you do have to put in effort as well with the removable aligners to get a good result, and there's not a big difference in price. But it is also a very good option. We offer that as well.
It's a bit like any type of dentistry. There's lots of different tools out there in adult orthodontics. It's making sure that you get assessed properly, and then obviously picking the right tool for you. But that's brilliant. Thank you for that, Yaku. Thank you for explaining that to us.
Thank you very much, guys. And again, if you want more information, you can leave a comment down underneath the video, or you can contact us by phone or by email or on our Facebook page. Thank you very much.
Thank you. See you next time.
Bye-bye.